Relationships. My name is Boris Filgorin, and I'm with McSilver McTac, and we're today joined by a number of our training partners, and they'll introduce themselves as we move through the presentation. Again, just to remind folks, this is actually a first part of a Part 3 series, with office hours being the fourth part of it. And it's really a continuation of our Adult Behavioral Health HCBS roadmap that actually started last year with our landscaping webinars, which are recorded and can be found on the McTac website. Also was followed by recently in our in-person presentations on recovery, and this is a continuation of this. And again, as I mentioned, this is a three-part series with office hours. And just to remind folks, this particular segment of the roadmap will conclude towards the end of June, early July, as following these webinars and office hours, we'll be once again on the road doing in-person presentations. So stay tuned to that information as well. And just some basic housekeeping rules, as always. Just to let folks know, this presentation is being recorded, and both the slides and the recording of this presentation will be posted on the McTac website and will be available for download and viewing pleasures. And also, we will be taking questions and hopefully providing answers. I would encourage folks to submit their questions throughout the presentation through our chat box. And if time allows, we'll try to get to them if possible. Again, as I mentioned at the end, our fourth part of this is office hours, which is dedicated to the questions that we're going to be getting throughout these presentations and also in between and so forth. And so you'll get more information on the office hours, but it really provides an opportunity not for us to present, but really to have more of a dialogue with all the participants and also gather all the questions. So we still encourage you chat in questions. We might not be able to get to them today, so we apologize, but we definitely will try to get to them at least during our office hours. So with that, I will pass this over to, I guess it's Daniela, who's going to take over from now and jump right into the presentation. So thank you to all. You might be on mute, Daniela.
I just unmuted. Thank you, Boris. Okay, so before we get started, I just want to say welcome, everybody. And I wanted to give people a little bit of background about how we're going to do this webinar today. So some of this webinar is, you guys listening to me talking, which I know you love. But a lot of what we want to do with this webinar is really make it as interactive as possible. So we're going to have lots of questions for you guys. And we do really want to encourage you to use the chat box to type in your answers to the questions, and then we're going to share everyone's answers together and have hopefully what we think is a nice conversation. So with that in mind, I'm going to ask Paul to start us off with the learning objectives for today and then lead us into our first chat question.
And as Daniela mentioned, we're going to work you hard today because much of today's webinar is really organized around being interactive. We've got a bunch of questions. We're calling them Chatbox Questions, and really want to learn from you about your experiences and your perspectives as they relate to recovery, and especially recovery-oriented relationships. So just very quickly, our learning objectives are to describe what is meant by recovery, to understand the importance of recovery-oriented relationships, to identify the characteristics of recovery-oriented relationships, and to know how these relationships can support self-help. And we've got about an hour to do that. If we can have the next slide, please. So this is our first question for you, and we'll give you a couple of minutes to answer it. So the question is, how would you define recovery for individuals diagnosed with mental health or substance use issues? So please take a minute or so. You see your chat box on the screen. Spend some time typing up your perspective. and we'll be doing some sharing and learning from one another. I see we have over 60 participants on the call in the webinar today, so our hope is a number of you are willing to take the plunge and type up. I'll give you a couple of minutes to do that. In the course of today's webinar, we're going to have about a half a dozen of these chat box questions, each of which drills down a little bit more deeply into the issue of recovery and recovery-oriented relationships.
Okay, so we've got a couple of responses.
Yeah. I see we have some folks beginning to type up.
All right, so the first one is to return to the maximum level of independence prior to a crisis. And then someone else typed in, recovery looks like symptom or use reduction and living a life that is fulfilling, forward-driven while working on goals. We have another one. Recovery would involve engaging in treatment with a therapist and or medication provider, also actively moving toward wellness. A journey that they agree to take in order to regain their level of self-control or independence. Mental health services that are client-centered, non-judgmental, strengths-based, focused on helping individuals being able to function with daily life independently. When a person is able to enjoy their life with the skills in order to face different setbacks and can pick back up and learn from their mistakes or ask for help. Got lots of thoughts. I can keep up with all these. Helping the consumer to define, I just lost one. Living with whatever illness or substance use issue may exist to the point where healthy functioning and participation in life goals is possible. Developing coping skills that enable a person to function healthfully and freely in a self-determined manner. Living the best life possible. Reaching a level of functioning independently with or without some supports that are identified by the individual, not being mandated, but continuing symptom management successfully. Sharing your story and goals to work towards recovery. Wow, we're getting tons of answers here. Recovery is holistic in that it builds on his or her strengths, talents, coping abilities, resources, and inherent values. Recovery would be where the client and those around them can have a healthy and hopeful relationship with the ability to function at a normal lifestyle. A return to baseline functioning with an absence of symptoms or where symptoms are managed appropriately so an individual can live what they define to be independent, healthy, productive, and a fulfilling life. Recovery is a process. It is client-centered and having the empowerment to make choices in life. A process of gaining control over one's life and gaining the skills, strengths, supports, and resources to chart one's path to health and wellness. Managing symptoms effectively, living a meaningful life that's important to the individual based on their hopes, dreams, and desires, defining themselves and partnering with them to achieve this. I think that's all of them, which is a lot. Thank you, everybody, for all those great answers.
I think that's plenty. So I think it's fair to say that our participants really get it. I mean, people have a good perspective, and you know, we know that we've certainly been talking about recovery for quite some time, you know, in the field, but it's really good to see that people get it. And really for the remainder of this webinar, we really want to be focusing in on relationships and how relationships can be facilitating or not facilitating, you know, one's direction towards recovery. So thank you all for the active participation. Look forward to more active participation in the rest of the chat box questions, which will come in a little while. But it's really good to see we're starting out in a place where so many people really do grasp the concept and really do get it. So thank you so much.
Okay, so we want to share one more definition of recovery with you guys. Recovery is a deeply personal, unique process of changing one's attitudes, values, feelings, goals, skills, and or roles. It's a way of living a satisfying, hopeful, and contributing life even with limitations caused by illness. And recovery involves the development of new meaning and purpose in one's life as one grows beyond the catastrophic effects of illness.
And this comes from Bill Anthony and his colleagues up at Boston University Center for Psychiatric Rehabilitation, which really, began work in the area that we now call recovery, going back to the 1970s. So in many ways, these are some of the first folks who began to shed some light on all the things that you've all described in the chat box.
Yeah, and one thing that we're going to stress throughout today's presentation is that recovery really is an intensely personal experience. There's no one yellow brick road that people follow. People come from different religious backgrounds, cultural backgrounds. They may have a history of trauma or and everyone really has their own personal preferences. So there are multiple ways that people reach recovery, and whether that's, a traditional treatment setting, using faith and spirituality, natural supports, supports from other individuals or family supports, mutual aid groups, criminal justice interventions. And most of the time we find that people use a number of these, not just one of them, as they work towards their recovery with the goal of full re-engagement, using the hope and resilience and health and wellness that comes from all of those supports, right? So we're going to take a look. Health, home, sense of purpose, and community all support recovery in different ways. So SAMHSA has these 4 domains laid out for us, so we're just going to go through this slide and talk about how each of these sort of help someone on their road to recovery and support in their recovery. So the first one is health, overcoming or managing one's disease. For example, if abstaining from alcohol, illicit drugs, non-prescribed drugs, medications, if someone has a substance use disorder, so making informed, healthy choices that support both physical and emotional well-being. Home, having a stable and safe place to live, having a sense of purpose, meaningful daily activities like work, school, volunteering, caretaking, and the independence, income, and the resources to participate in society. And then the last one is having a sense of community, so having relationships and social networks that provide support, friendship, love, and hope. So you can just imagine when you're looking at this, how stress in one or more of these areas, like lack of a safe and stable place to live, can really impact on someone's recovery. Okay, so we wanted to be sure to include medication-assisted treatment in our discussion today, so let's talk a little bit about recovery-oriented systems of care. And for folks that don't know what a recovery-oriented system of care is, it's a network of community-based services and supports. It's person-centered. It builds on people's strengths and their resiliencies and the resiliencies of their families and communities to really achieve abstinence, improve health and wellness and quality of life for people with mental health issues and or substance use disorder. So combining treatment medications with behaviors is the best way to ensure success for most people, and approaches are really tailored to address specific treatment, the specific treatment needs for the individual or the person in treatment. And medication-assisted recovery is a practical, accurate, and non-stigmatizing way to describe a pathway to recovery made possible by physician-prescribed and monitored medications, along with other recovery supports. So, like we said earlier in a couple of slides before at the beginning, is this is just one component of someone's recovery. People have different options on their path to recovery, and the best success for recovery for people with substance use disorder is medication-assisted treatment along with other supports like counseling and peer supports. And the medications that are prescribed for the treatment of the symptoms of the disease, and then by treating the symptoms, we really allow for recovery to happen. So again, recovery is this intensely personal experience, and many people do choose medication-assisted treatment as an evidence-based practice that is part of their recovery process. So let's move on to the idea of personal independence and recovery. So again, there are a variety of paths that people take. Recognizing preference and choice helps the person strive for community integration. It gives someone the dignity of risk and the right to fail and to learn from those experiences, and really helps to develop mutual aid or self-help, peer, and natural supports. So I think this is going to take us into another, or actually we're going to have a few chat box questions coming up so we can have a little bit of conversation.
Yeah, Daniela, we've got a bunch of them coming up now, and each of these is going to take us to kind of, in some ways, a deeper level. You know, one other comment I want to make before we get to the chat box question itself, and that is this. You know, Daniela was putting a lot of emphasis on a very important idea, and that is that recovery is really defined by the individual. And so what we want to be clear about is different folks are going to be moving towards different personally meaningful goals and outcomes. And so when we try to measure or get a sense of whether recovery is happening, it really is all based upon what the individual's desires are and what goals are moving towards. And it's something we just want to keep in mind, that, you know, different folks are defining their own recovery in very different ways, and that's a good thing. And we want to be aware of that and really very much respectful of that. So we're going to segue into this whole issue of relationships, which is really the focus of today's webinar. And so the next chat box question is, do you believe that relationships with practitioners can impact an individual's recovery? If so, how? And once again, we're going to give you a couple of minutes to type up, please. We've loved the response to the last chat box question, so keep them coming. And tell us about it. You know, do you believe? And if so, in what ways? If those of you who are practitioners yourselves, you know, how has this worked out? We'll give you a couple of minutes to type up. Give you another minute or so to type up.
I don't know, Paul, maybe our chat box got broken.
Oh, I see some coming in now.
Okay.
I see a bunch coming in now.
Excellent. So we're just going to take a second to get those organized. Okay, so I think peer relationships are more important.
And if I could just jump in on that, because we don't have the names of the folks who are typing up, for the person who typed this up, or others for that matter, if you'd like to expand upon that and tell us why and in what way, we'd welcome to hear from you on that.
That's a good point. So then someone else said, yes, trust and healthy examples of relationships are needed from some people. And also, many of the clients do not have someone that they can talk to that's non-judgmental and allows them to make decisions on their treatment or mistakes on their treatment. It may not make a difference depending on the mental illness, is what another person had to say. This next person saying, yes, a practitioner may be someone's first or only safe, stable, nurturing relationship and can be a gateway to linking or building other such relationships supportive to recovery. That's a really good point.
Wow.
Someone else said yes, but not for long-term recovery. I believe practitioners aid in the beginning of recovery, but when looking at recovery as a journey or lifelong, practitioners can impact the start of recovery, but natural supports and other community roles are what will carry that person through the other legs of their journey. So this came to us from someone named Ashley. And Ashley, I don't know if you had a sneak peek at the slides, but you are spot on. There's lots more than just that practitioner relationships. So, yeah. Someone else said, absolutely, the connection between the client and the provider make a huge impact. Clients need to feel connected, allowing for trust and openness. It's a journey for wellness that they go on together. Years of experience, ability to be open and non-judgmental may foster trust, which the patient can then use as they progress their recovery and maintenance plan. Someone else said, yes, if a person is uncomfortable with their practitioner, they are less likely to speak honestly. We have another person. Everybody's saying yes, yes, yes. If there's an effective,
so far.
If there's an effective therapeutic alliance created based on mutual respect and trust, it gives the recovering person another resource to draw from. Someone else is saying it can either be a support and an encouragement towards recovery, or it can be a hindrance and enabling behavior to work against recovery. That's an interesting one. Someone else is saying, yes, it's vital for the practitioners to have a solid relationship with their clients. I am an in-home service, and I find that when there is no solid engagement, which takes time and commitment on both sides, we make little progress. This other person is saying, absolutely, the customer will be more likely to succeed if they feel empowered and supported. Conversely, they will be hindered if the relationship is paternalistic or conflictual. Practitioner may invite the person to believe in certain ways about the possibilities or lack thereof in relation to their goals and hope. Having a good relationship with a practitioner will help a person in recovery be motivated to engage in treatment. And if a practitioner is not supportive, then the words we say can have a long-lasting impact.
And we're going to pick up on that with another question in a few minutes.
And we actually still have a few more. I think we have time to
get through them. This is great.
Yes, change occurs in the relationship with others. A practitioner can function as a catalyst for change, a support for the individual, and to help an individual clarify or define their goals. I believe that practitioners can impact an individual's recovery if the relationship is strong and the person and practitioner can agree on the plan for working towards their recovery. Sharing challenges that you might have in common from your experience is helpful. Evolving from treatment to regular life is crucial. And I think that's one last one, that this relationship that practitioners have is just one tool that someone can have in their toolbox.
I think, that's a great one to finish up on, because, the point here, and I think many people have said this, is that the relationship clearly can make a difference with a practitioner, but it's not the only tool, and recovery, once again, is an individual process, and people get there in different ways. But what we do as practitioners can make a difference in the positive as well as the not so positive way. So once again, I think, clearly, Danielle, in many ways, we're preaching to the choir, at least for the folks who are typing up here. And that's a good thing. So we've got another question that drills down a little bit deeper, and that is, can you provide examples from your own experience that illustrate how an individual's relationship with a practitioner supported his or her recovery? So anything, anything from your own experience that gives us a nice illustration of this, of how maybe when you've been a practitioner yourself or others you've observed, how it's really made a difference. Give folks a minute or two to type up.
So we have the first answer coming in. And we are just getting them together. So this person is saying that Well, actually, I don't know. Howard, I'm a little confused about what you're saying. It looks like we only got half of what you were writing in. Something about being referred to you or referred you to a job opportunity that you now work at.
So it sounds like perhaps the practitioner was involved in helping to find work.
Right. Right.
Might be a supported employment practitioner.
A client of mine has a therapist that he doesn't connect with. He doesn't feel heard, doesn't feel that he cares for his success at wellness and actually has stunted his progress.
So there's an example in the negative direction. And, you know, this whole issue about doesn't feel heard really gets at a conversation that we could have around listening skills, and how for many practitioners, you know, for all practitioners, probably one of the most important skills we have is listening.
True, yeah. Someone else has typed in that they've had patients in the past who were self-abusive that have stopped for periods and who have done so because they didn't want to disappoint their therapist and called to talk instead of harming themselves. As a counselor, building a relationship with a client and providing them with information regarding free groups in the community, it was a trusted relationship that gave the client the courage to branch out and try new things. Groups then built autonomy into the recovery process for that person. Okay, thank you, Howard. Howard's saying it was a wellness peer coach. Finally, finding a psychiatrist that gives me more than 5 minutes and gives me over 40 minutes to talk, wow, and get to know me versus psychiatrists in the past that have barely gotten to know me, but it took a long time to find that supportive treatment provider.
So lots of examples here, Daniela, of ways in which practitioners can make a difference. Here's another one that just came in.
Yeah, having a provider be available for ongoing support through the relationship caring as well as skill building has led to personal development and change. It's hard to quantify. I imagine it is hard to quantify. And you know what? I think what people are really saying is that building these relationships really does take a lot of effort and time, and people really do need to be committed to that process. So we've got one more answer for this one. A patient is more likely to speak with their practitioner because of the trust that the patient has. The practitioner here was very instrumental in getting a patient into treatment because of the trust that was developed over time, and it took about 6 months, so it does, in fact, take time. We know that. This person has been in recovery for 26 years, and their practitioner was so supportive and helped them into treatment and referred them to mental health counseling, which was important for their recovery process. So thank you for sharing that about your recovery process. We have a few more, and then I think we need to move on because I feel like we might run out of time here, Paul.
Yeah.
Everybody's got lots to say. Working within the juvenile justice system and recognizing the positive rapport between practitioner and individual and the change in the individual's mood when parents would arrive. The practitioner has a good relationship with me and knew a job would benefit me, so it kept me informed. And we were able to help clients maintain a sense of hope about their future when they were convinced they had no options would produce a positive change in their life. So being present, validating the struggle, and looking beyond the obstacles was really helpful.
I think we're getting a consensus around this. Lots of examples, and it's really quite something. It's funny, yesterday I was involved in doing some training with some supported employment specialists. And one of the things that came out in our conversation in the course of the training was that those who were really experiencing the most success, and once again, viewing employment as one recovery outcome for some people that can be very meaningful, the folks who really had the ability and the desire to spend time and really listen and share and really try to take the time to understand the person's perspective as they were beginning to develop their employment goals. So it's very consistent with what a lot of what we're hearing here, I think. So we're going to move on to another chat box question. And this is the opposite. We've already heard a couple of comments about this. How can practitioners mess things up? How can they stifle an individual's recovery? Give us some specific don'ts. And I'm going to start with one, and this goes back, and a number of people have heard me tell this story. Back at a time when I was working in a day program, which nowadays you might view as, kind of have evolved into pros programs, and how we really had a policy back then that when people came into the program on intake and came in with the recovery goal of employment, we told them, that's wonderful, let's wait 6 months, because we need to get to know you better and make sure you can handle the stress. Talk about totally undermining the person's recovery vision. And, this was a long time ago, and we did this not because we wanted to be mean, but we actually believed that was the proper perspective back then. We were wrong, but we thought we were doing the right thing. So there's an example of how very easily the relationship can really get in the way of one's recovery. So please type up with other examples that you yourself have been involved in or you've witnessed or that sort of thing. Because it's important that we be aware of what not to do as well as what to do. We'll give folks a couple of minutes for this.
That's a really good point, Paul. Similar to your experience, when I was working in a day program, we used to tell folks that we wouldn't help them find jobs until they were clean and sober for 6 months, and we didn't realize that we're hurting them. We weren't helping them because that employment, that job, was something that probably would help them in their recovery.
Exactly right. We did so many things that we did so many things we thought were the right thing, but as research then, subsequent research showed us that we were wrong, which is why I'm glad we're able to make some changes in how we do business. So please, folks, type up. Let's hear from you.
Yeah, so we've already got some answers. Keep boundaries. Know when it's appropriate to self-disclose. They don't understand that people relapse, and that's part of recovery. Empowering people to teach them, not do it for them. So waiting lists for services can hinder the ability for recovery. That's an interesting one, too. That's right.
Yeah.
People want to come to treatment, but if you tell them they have to wait, then what happens,
Exactly right.
Verbalizing judgment of a person's lifestyle or life choices can hinder recovery and that relationship of recovery. Not listening actively, prescribing without listening.
Yeah. There's that issue of listening again and really taking the time to get to know the person's perspective.
Yeah, don't tell someone that their goal is out of reach or far-fetched, even if you think it is. Instead, help them in the steps to getting to their goal. Employment first, employment now. I like that one.
Can I tell a quick story? Daniela, can I tell a very quick story on this one? I'll probably just be 2 minutes. So one of our employment specialists here at CPI, his name is Raymond Gregory, and Raymond used to work in Washington, D.C. And he tells a story about this young man that he was working with, helping to find work. And the young man told him that he wanted to become an astronaut. And this was a young man with a history of diagnoses and such. And, it could have been easy for Raymond to have dismissed it, but he knew better. So Raymond took the time to get to know the young man and understand and come to understand the motivators. And long story short, the young man wound up with a job that he loved at the Smithsonian Air and Space Museum, which really tapped into his interests and really was something that he felt very good about. So, so it really is, not dismissing people, not telling them, that we don't agree with the goals, but really taking the time to understand the motivation behind it and finding ways to find goals together that make sense.
Yeah, I think that's a really good point. And someone actually just typed in, don't make assumptions.
There you go.
If a practitioner might self-disclose and then set an example for how recovery might happen such that the individual might think that this is how recovery should happen. So not really understanding that people have different options and different paths along the road. If a practitioner doesn't understand strengths, they might not be able to advocate for the folks they're working with. This person is saying, I have heard a consumer tell me that his psychiatrist recommended that he probably would need to find a job in the back of a library to be in a quiet environment. So again, making assumptions about what works for people and not really talking with them about what they want and what their needs are. This is another good one, not allowing people to make mistakes and telling them what to do instead of allowing them to find their own answers. Not allowing folks to problem solve, being judgmental, not realizing that there are several ways to get to one endpoint. Self-disclosure in peer advocacy is accepted, exclamation mark. Yes. learning from each other, having that shared experience really is helpful. This person is saying, don't create therapeutic barriers. Don't veer too far off of the foundation of therapy. Keep boundaries, but keep understanding that services are time limited. So line up resources so that you don't, so that people do have other options. Practitioners sometimes project their own anxieties onto clients. It's helpful for practitioners to have the ability to self-monitor their countertransference. And never say that something is not possible. In an effort to be real or honest with people, we sometimes injure a person's sense of hope. Dreaming and imagining is the first step in motivating someone to move forward. I think that's a great
point. The other thing I would add to that, Daniela, because I think this individual is absolutely on the money. As a profession, we are horrible at making predictions. We're horrible. I'm a clinical psychologist. I trained people throughout my career on how to do psychological assessments. So what I can tell you is we're not real good at predicting. We may come up with some probability statements, but that's not the same as a prediction. And oftentimes, especially if we're looking at work or other kinds of outcomes, we don't know. And so it's not our place to tell somebody what is or isn't possible.
That's right, because that person is really the expert in their lives. We're not the expert in someone else's life. Yeah.
Yeah, and we just don't know. We're not all-knowing. We're just not.
That's right. All right, so let's move to the next question, shall we?
And we already picked up on a little bit of this one. Do you believe that relationships with peers and other natural supports can impact an individual's recovery, and if so, how? We've heard this already from one or two people. Please add to that. I think one comment already was that, for some individuals, the relationship with a peer can be the most powerful in terms of helping somebody towards recovery and supporting their efforts. So please take a minute or two to type up on this one.
So the first response we got is yes. They can be positive or negative for an individual. They can be more long-lasting. There can be more long-lasting supports than practitioners. People often need to feel that they aren't alone and aren't the only ones that have gone through some of these difficult issues. Knowing that another person has been able to reach some recovery goals gives hope. They are essential. Relationships are rooted in natural commonalities, and practitioners and client relationships is not natural in nature, therefore its impact is limited. Genuine relationships and connections are able to be stronger than therapeutic relationships. This other person is saying yes, realizing one is not alone can be a great relief, and also learning from peers can seem more realistic than from a professional. Yes, of course, people need a support system to fall back on and to reassure and encourage them in any instance. If there are no supports, people will go backwards. Peer and natural supports might make way or harden the road to recovery, though through more readily accessible positive supports, day-to-day practical interactions. In a positive way, peer relationships can be very helpful, but negative interactions with peers in a program can disinhibit a consumer from wanting to return to that program. Absolutely, peers are the experts. They can be more effective with the person and can build a better relationship and also walk them through the process like a mentor or sponsor.
The one thing I'd want to add to this is that, we're talking about a couple of possibilities here. One, peers as in colleagues and friends, and the other is folks, increasingly we have the role of peer specialist. And I know certainly within ACT teams and within on-track teams and other areas, we have peer specialists who bring, their lived experience into the work. and can be really incredibly helpful and inspiring, you know, related to an individual's decision around recovery and direction they go in. So thank you all. It sounds like we're on the same page, and clearly peers can make an enormous difference here.
Absolutely.
Next slide.
One more chat box question, folks.
One more. We're working you hard. We promised we would. So what are the characteristics of a recovery-oriented relationship? We've heard this in all of the responses we've had so far, but if you can boil it down to a few adjectives or a few qualities, what would you say? Let's give you a minute or so to respond.
So someone is saying supportive and non-judgmental.
Absolutely true. And the non-judgmental is so important.
Trust, integrity, honesty, openness. And it looks like we have another one or two coming in. Trust, support, caring, helpful, strengths-based, client-driven, supportive, appropriate confrontation or constructive feedback when needed, mutual respect, the customer is the expert, open, trusting, non-judgmental, boundaries are set and respected, the client is first and chooses their own treatment plan, collaboration, having a strong connection with people that you are working with, having empathy, empowering people, and being respectful of their intentions. Those are all really good answers.
Wonderful. And we're seeing a lot of overlap in the adjectives people are using, so that's just terrific. Thank you, folks.
Which, you know, it's pretty much what's on our next slide, Paul. So,
yeah, you really, you know, you all have set it up perfectly, and you didn't see the slides.
We couldn't have planned it any better, really. No, but we really do want to thank you for all of your participation with the Chatbox Questions. It's nice to have like an interactive conversation with people, even though we can't see each other. So we really do thank you for that. So this slide basically puts everything that you guys said with maybe a couple of more. So recovery-oriented relationships can be with practitioners, peers, or natural supports, or any combination of those people. They should be person-centered. They should inspire hope. They should build on people's strengths, not their limitations, and be supportive. They should be culturally competent and trauma-informed. So, you know, really keeping someone's background and religious beliefs in mind, and also their experience of trauma. Uh-oh, my slide is not advancing. There we go. Okay, so moving into the idea a little bit more about self-help. So we're talking here about the continuum of activities and networks that help people along in their recovery process, and we're going to go into a little bit of detail on each of these concepts, but the concepts of personal medicine and self-directed recovery, self-help groups, peer support, natural supports, and then recipient-run programs. So mutual assistance, really people in recovery, you know, I think you guys all really already mentioned this through the chat, but, you know, people in recovery might feel more comfortable with others who have had that shared experience. So this is definitely one type of recovery relationship that is more reciprocal. It's more peer relationship than professional relationship. It's a little more freer and also enduring because it sort of can lead into that natural support that we were talking about before. And then something we wanted to mention is the idea of personal medicine. So this is an idea or a phrase that was coined by Pat Deegan. So personal medicine is the idea of any non-pharmaceutical activity, so not medication-related strategy that helps people with their symptoms, helps decrease symptoms, and then increase personal wellness. So using, you know, what you already know and what makes you feel good, so whether that's volunteering or working or being a parent, reclaiming a lost role, any enjoyable activities, hobbies, fishing, crafting, painting, So basically, the idea here is that someone's personal medicine is really as important to them in their recovery as other things because it increases their self-esteem and makes life worth living for them. So that's, which is obviously very vital to someone's recovery. And then there's the idea, of course, that physical and behavioral health, sort of the interrelatedness between them. So when we're talking about recovery, it's also, you know, health and wellness, right? So the idea that people should have individualized, person-centered care that fosters personal responsibility, implementing prevention, early intervention, health promotion activities, and really communicating with healthcare providers. So recovery-oriented relationships really also extend to non-behavioral healthcare providers. And then we've got, you know, more about natural supports, which I think you guys all sort of, it sounds like you guys are on board with this. You're all sort of knowing about it and know the impact that natural supports can have on people's recovery and how important those relationships are for people in recovery. So, you know, having friendships, being involved in spiritual or faith-based communities, recreational activities, community organizations, cultural activities and associations, and peer support. So we have one last chat box question for you guys, and then we're going to wrap up. And I think we might have about 5 minutes for questions if we can get to that. Here's our last chat box question for you.
And it is, how can your work as a practitioner support self-help? What can you do to really facilitate and support self-help? Give you a couple of minutes to type up, hear what you have to say.
So the first response we got is listen, be open, and helpful. So again, that idea of listening really has carried out throughout this entire webinar today, right?
Yeah, if we were to focus on one skill and one skill only, I'd put all my money on listening.
Assist in finding coping skills that work. Show people ways and be available when the listening ear is needed. There we go again with the listening. Provide community resources. Assist in finding like-minded people or organizations and listen. Know resources. Use reflective listening. Review goals and objectives frequently. Talk about successes. Provide homework. So allowing the person to develop their own recovery plan because the ownership will help build that self-esteem. Encouraging people to move in the direction that they feel is most helpful and supportive. Offering options that promote self-help.
Can I add something to that, Daniela? I think in order to do that, we also need to know what self-help opportunities are available in the area. So becoming knowledgeable about self-help options, I think, is very important.
So knowing the resources, knowing what's around,
right?
Yeah,
exactly.
By introducing people to the concept and discussing ways it can benefit their recovery, provide resources to support self-help. There we go. It's like they read your mind, Paul. Listen a lot and then plan. Network with your community to provide education to people about what's around them and what's within their reach. Be a support during their journey. This person is saying use motivational interviewing to help the person evaluate their goals. And I think that was the last one, yeah.
This has been such an active group of participants. Thank you so much for all your responses and your ideas and such. This is great.
Oh, we got 2 more. The first one is recommending peer supports like 12-step programs and shifting the culture from taking care of people to having them tell us what's best for them and finding ways to help them do that more independently. I think that's a really good one. We're not taking care of people anymore. That was like 30 years ago. All right. right. So I think that's it. We do have about 5 minutes left for questions, so we are happy to take any questions. Paul, if you wanted to add anything before we do some Q&A?
No, other than I'm just really so pleased by the responses we're hearing from folks, and you know, clearly recovery is taking root, and that's just a wonderful thing to witness. So I appreciate that. So I guess if folks have questions now, they can feel free to type up in the chat box. If you or I or anybody else on the call can respond now, we will. If not, I guess we'll take notes and get back to people.
Right, and then whatever questions we don't get to today, we will certainly keep track of those and take care of those questions during the office hour. So the first question is, one of the early slides mentioned ROSC. Could you please repeat what that stands for? So that stands for Recovery-Oriented Systems of Care. We have another question. How can we translate this orientation to mental health work with children and adolescents? So I think this person is asking, like, is there a difference as far as recovery-oriented relationships with adults versus children and adolescents?
Well, let me kind of talk off the top of my head, and feel free to jump in, Daniela, okay? I think there are clearly some commonalities, and I would start with listening. It doesn't matter how old the person is. You start with listening and getting to know their point of view and trying to understand what's important to them and trying to understand their vision and their hopes and their dreams. And, you know, so part of this is all about engagement, isn't it? So I think that's
right.
You know, probably a major commonality is it's about engagement and listening and being respectful and not believing that we know it all, but instead maintaining an asking stance where we really try to learn from the individual.
I think that's a really good point, Paul. It goes back to the idea that the person in recovery is really the expert for themselves. And whether that's an adult or a child or adolescent, that person is the only person that knows what's going on inside of them. So as practitioners, we need to really be able to listen and try and be creative in ways that we can sort of reach people.
I think another commonality, perhaps, is that, you know, we're always talking about the importance of working with natural supports. And, you know, with kids and adolescents, oftentimes those natural supports are readily available in the form of families and parents. And so, you know, that's another thing that there's some commonality. I think beyond that, you know, with kids, you know, the parents or family are likely to play a more prominent role in the work. So that might be a little bit of a difference there.
Yeah, that's a good point. We do have another question that came in. How can we disseminate this information to programs that have low practitioner engagement?
We have been asking ourselves this question for a long time, actually. And really, part of this, don't laugh, I mean, part of this has to do with how do you incentivize this? And I think there are different ways to incentivize for different people. For some folks, continuing ed is an enormous incentive. Now more than ever in New York State because of the requirements for social work and mental health practitioners and such. For others, the incentive, you know, has to do with wanting to do a better job. And so you really want to understand the frustrations that the folks in the programs have and how, you know, this perspective might help with that point of view, might help, you know, overcome some of the frustration.
And I'm going to give a plug for NIAPRIS here. Our collective, our training folks do an excellent job. They will come to your site and do training on engagement. So if you are interested in that, you can reach out to me, or you can reach out to any Ruth Cullen-Wagner over at NIAPRIS, who coordinates all of those collective trainings. But we are happy to do trainings.
Very important. You know, the other thing, and this, you know, I've seen this happen many times, and that is sometimes the most powerful influencer, the most inspiring way to get through to practitioners is for them to hear from individuals who've been receiving services who talk about their recovery stories. I mean, that can really, you know, get people to think in ways they wouldn't have thought of otherwise.
It's true, and that can be much more of a powerful way for people to really hear about recovery and understand, you know, because they can identify with what someone else has gone through.
And one other, you know, thing to think about is oftentimes programs respond to the expectations that are placed upon them. And as we're moving more towards value-based payment, there are expectations around achieving certain kinds of outcomes, and, you know, participating in this kind of continuing education will help move towards those outcomes.
That's a good point. So before we close off, I just wanted to, if people are interested in that NIAPRS training, you can email, again, her name is Ruth Cologne Wagner, and her email is ruthcw@niaprs.org. But it does look like we're pretty much out of time, Paul.
I know. Once again, let's thank everybody for a very, very active hour and for sharing your perspectives and for sharing your wisdom, because I think there's quite a bit of wisdom that was shared today.
Yes, this was definitely a great kickoff to this series, and we hope that you all will join us again next week. Thanks, everyone.
Take care, everybody.